Healthcare is broken. In fact, it's really broken. And that got me thinking about a very simple question. Is it possible to fix healthcare? After years of researching and pondering that simple question, I believe the answer is yes. Yes, we can fix healthcare. I discovered an incredible big shift that must occur in order for us to avoid the massive collapse of our current hyper-interventional healthcare system. The big shift is the secret to the future of healthcare. But before we explore the real problems and how the big shift will transform healthcare forever, we need to ask ourselves a simple question. How do we get ourselves into this mess in the first place? So let's go back to the beginning of healthcare. It really began back in the caveman days when primitive first aid that used sticks and rocks and even loincloths to control bleeding and to fix broken legs. In other words, we were really limited to just rendering basic first aid back then. Then healthcare entered a major inflection point as we began to tackle infectious disease with major disruptive innovations that included vaccines and even antibiotics. During this period of time, we began the process of building robust scientific knowledge that launched us into the next phase of healthcare. Modern medicine was created the institutionalization of healthcare with hospitals and clinics and formally trained physicians and healthcare providers. And really, this is where the problem began. We began to develop an economic system that financially rewarded within the healthcare system industry anybody for doing something to patients. This included surgeries, more drugs, more medical devices. The entire industrial focus was centered around the economic premise of being paid to do something to a patient. Modern medicine turned into an industrial monster that not only created economic incentives for doing things to patients with a keen focus on sickness, it also shockingly punished caregivers and anyone within healthcare to focus on health over intervention. During the evolution of modern medicine, healthcare costs skyrocketed 5 times, while patient populations continued to grow sicker. In fact, as much as 70% of every dime that's spent on healthcare is spent really on self-inflicted chronic disease. Patients were eating their way, drinking their way, and even setting their way into serious illness. But not to worry. The healthcare industry complex was more than happy to create a new drug, new device, surgery, or to intervene in some way that they got paid for. Meanwhile, healthcare started to be impacted by another insidious trend, the silver tsunami. With a rapidly aging population that is getting sicker by the minute, healthcare is at a tipping point. Shockingly, despite the current condition of healthcare, modern medicine then transitioned into a new phase of hyper-intervention. And during this phase, we're still seeing a continuous conveyor belt of more sickness interventions. So where are we today? The coronavirus pandemic has pushed us to the limits. We're running out of money. Medical care and devices are being rationed. Patient populations are getting sicker and older each and every day. It's simply not sustainable, and we are now at the tipping point. After 40 years in the healthcare industry and a lifetime obsessed really by fixing healthcare, I have some good news. Healthcare is fixable, but there's a caveat. We need to change the conversation, and that is the big shift. It's the shift from a sickness focus of diagnosis and treatment to one of anticipation and prevention. This shift will be enabled by a wide range of connected and enabling technologies. It will include continuous patient monitoring that will be evaluating through artificial intelligence to diagnose you actually 24 hours a day. It will leverage a wide range of new economic models that actually flip the current model on its head. Instead of rewarding the healthcare industry for treating your sickness, it will reward the healthcare industry for keeping you healthy. This simple philosophical change will significantly reduce the cost of healthcare. The new economic models will provide significant improvements to access to healthcare while improving the way in which health is being addressed for a very sick population. Fixing healthcare is a movement. It's a movement that builds a sustainable and scalable healthcare system that represents a massive and disruptive change. The change will provide both the data and the time that caregivers need to get back to the roots of healthcare. You know, back when doctors and patients created beautiful partnerships. But healthcare and the healthcare industry will fight this big shift as billions of dollars are at stake. In fixing healthcare, we start a new conversation about a realistic and thoughtful path forward. Let's fix healthcare. Our families' lives depend on it. Join the movement.